How come the cleanest city has the dirtiest water?
In Indore city, at least 4 people have died and over 200 others have taken ill after consuming water supplied by the municipal corporation.
What went wrong in Indore and how it violates your right to clean water? Indore has been ranked India's cleanest city for not just this year but for past consecutive 8 years. Yet, the unclean drinking water has led to a diarrhea outbreak which has already taken 9 lives and more are at already risk. Hello everyone, welcome to Vajiram and Ravi's Flash News. My name is Shubhangi Singh and today we are going to understand that how the cleanest cities can also have unclean underlying issues, and this is where we need to talk about not just urban infrastructure but also deeper public health concerns and everything that lies around us. So let us start with understanding what exactly has unfolded in Indore. So if we talk about not just this very month but from past 10 days, we have seen an outbreak of diarrhea where there have been multiple vomiting and diarrhea cases which have been reported from the Bhagirathpura area of Indore. As of now, already 9 people are dead. There are multiple serious cases with more than 200 which are hospitalized, and if you talk about the effect of this unclean water, it is already 1400 plus people who have been affected. Now these numbers are to show you that this is not just a random case, this is a public health emergency which asks us to look into how badly our urban infrastructure is failing and our constitutional and basic human rights are being violated, because this incident is not isolated one, it is a pattern which keeps showing up across our nation in various ways. So if we talk about this particular outbreak, recent laboratory tests have confirmed that the drinking water has been contaminated, and this crisis has occurred in the city not only once but multiple times, which shows us that what we are labeling as the cleanest cities is just because of the visibility of it. We are not taking the concerns which are not tangible or which are not in front of us. Now let us try to understand that why exactly this situation unfolded in Indore. So if we talk about the cause, recent decipherings have pointed out to the fact that there was a leakage which was detected around the main water pipeline through which the drinking water comes, and this pipeline was lying under a toilet structure. Now the sewage from that toilet structure seeped into this water pipeline, because as we know, the water pipelines usually have negative pressure. So if there is any vacuum, it usually seeps or sucks in the contaminants or the things that are around. So this sewage seeped into the water, which was probably because there was an old pipeline, it might have had a crack. It is also possible that it was because of the intermittent water pressure, and also this highlights that how poorly we take the maintenance part of urban infrastructure. All in all, showing that this was a situation which was avoidable and there could have been things that could have been done in past to make sure that the situation that we see today wouldn't have arisen. But this also highlights that governance has failed, because the residents did not complain when the outbreak happened. They had complaining about it, and this complaint was taken in no consideration, no corrective action was done, and gradually it unfolded as a public health emergency. Because whenever we are talking about contaminated drinking water, it can easily trigger multiple diseases such as acute diarrheal disease, cholera, typhoid, hepatitis A and E, and all of these, if not treated well, then they can be life-threatening as well. And as we see in this situation, a routine civic negligence which could have been addressed has created this public health emergency which are lying in front of us. And when we are talking about the diseases which can be commonly triggered, hospitals would not know this is because of the issue of the infrastructure, of the contaminated water. They keep on treating the symptoms, but pipelines or the contaminated water keeps on creating the disease, and this is an endless loop. And as I said, it is not an isolated event just in Indore. Indore has seen such events in the past as well, and this is not an isolated event in our nation as well, where the contaminated drinking water is till date a huge issue. Because if you look at this given map, you will clearly see the percentage of waterborne diseases is highest. That means more than 25% in maximum of central India. Other parts such as if we talk about Gujarat, then we have Jharkhand, then we have Punjab, some states in northeast, they also show prevalence between 15 to 25%. And as of now, we understand the Madhya Pradesh, which has been highlighted in dark red, that shows the severity of the situation, because as I said, more than 1400 people have been affected, and that was come across in the recent household surveys that was taken up, where more than 8,000 people were examined. And in this situation, when we are talking about contaminated water, it puts children, it puts elderly at the most vulnerable position, and such situation can easily turn fatal, where life is at risk, and we have already lost 9 lives in this situation. Now, when we are talking about constantly the contaminated water and what it can do, it is not something that should be treated as a luxury. It is something which is required for bare human existence. And that is why when we are talking about right to clean water, it is one of the most basic human rights and also our constitutional right. Because when we talk about the legal context here, you have to understand that Indian judiciary has already mentioned it. It is not something that I am saying. Indian judiciary at multiple occasions has highlighted that when we are talking about right to life and liberty as per Article 21, then we are talking about right to health and safe drinking water in that very context. And the moment there is supply of contaminated water, that means we are violating a constitutional right, we are violating a fundamental right. And because of this, there is a very clear governance issue that has come in front of us, because what has happened is not something accidental. Supply of contaminated water is basically the state's failure to discharge on a constitutional duty. When we are talking about fundamental rights, especially this one, this is not which is limited. So when we talk about this particular situation, outbreak that has arisen, we get to see that a non-negotiable public obligation has not been fulfilled. It has been compromised. It has been compromised despite complaints, despite concerns, and despite such incidents that have occurred in past. This clearly highlights 3 things for us. Not just that this is a governance failure and violation of fundamental rights, but also this is happening in the cleanest city. And third, where we get to see that this is a repeated incidence, that means no lesson has been learned over the years. So now when we are talking about the human rights also being involved, and that is why NHRC has also entered in this particular situation, where it has gone ahead and issued a notice to the Madhya Pradesh government, and they have said that these deaths could have been prevented. The prior complaints were ignored, and this shows administrative inaction. So the entry of NHRC into this particular scenario also highlights the fact that this issue is not just a random municipal lapse, this is a human rights violation, and this also highlights and pinpoints towards the state's responsibility, not just the local bodies which should have addressed this. Now this is where we get to see that a statutory body, that is NHRC, is also highlighting that how this could have been prevented, which again highlights not just the 3 things I have mentioned, but also that how urban infrastructure is not just about creation, but also about maintenance. If maintenance is not there, then that urban infrastructure is meant to collapse. It is meant to harm, it is meant to create disasters. Now on the second thing that I was talking about, that despite Indore being the cleanest city in our country, this has happened. When we look at the scenario, in terms of Indore, you will find the aspects such which are visible. For example, if you are talking about solid waste management, you will see the performance is excellent. When you talk about visible cleanliness, excellent again. But when you talk about drinking water safety, pipeline monitoring, water quality disclosure, all of this which are something that you do not get to see visibly, all of these stand negative. So this also takes us into an insight that when we are talking about this rankings, when we are talking about the cleanest city, we are talking about absolute superficial level. We are not looking into what is not visible. And this water safety failure highlights that when we are talking about rankings, that's when we need to consider these issues as well. Because with government promising safe water through Jal Jeevan Mission and multiple other schemes, we need to understand, is it just about taps? Is it just about liquid coming out of those taps? Isn't it about the safe and clean water as well? Now moving on to explain you more that how this is a systemic failure, because as I said, this is not something that has happened in isolation. There is a recurrent national pattern to this where we have seen multiple urban diarrhea outbreaks, especially after monsoon where the water gets contaminated, the pipelines which are damaged, poor, which are not being maintained. These are the ones, usually the old pipelines. Then we have hepatitis E epidemics that we get into cities, and also cholera clusters, especially in low income areas. And all of these are contaminated waterborne issues. They can happen because of old pipelines, they can happen because of leakage of sewage, they can happen of lack of routine water checkups, or the delayed response of complaints if there is something other than this. But at the same time, there are certain structural issues as well, because we have no independent water regulator which is present in our country. We have no public water quality dashboard where this can be monitored. For example, if we talk about air quality, because of the hazard that it has become in our country, we are talking about AQI where we get to know air quality index. There is some extent of awareness, but in terms of water quality, no awareness at all. Then when we talk about the contractor accountability, there is a lot of opaqueness present there as well. And again, we have only firefighting method, that the action will be taken once something has happened, not before that. So these structural issues also need to be addressed. Otherwise, Indore is not going to be an exception. It is not an exception. It is just another incident in the huge list where we get to see this very repeated pattern every now and then. Can you tell me in the comment section what are the solution or what is the way forward to address this situation in our country? Now on this note, I will be concluding by pointing out that there are multiple public health governance lessons which were hidden in this unfortunate outbreak that we have seen, and these are the ones where we get to see that urban health crises are most often not but related to engineering failures. When we are talking about municipal corporations or the local bodies, these are the frontline workers when we are talking about public health and issues addressed. And it is important that with this incidence, we shift the surveillance from patients to infrastructure, their maintenance, and also making sure that health departments are also involved in this to understand that how water urban supplies can be managed. Urban planners are able to address the situation better. Now on this note, I will be concluding today's discussion. That was all from my side. As I said, let me know in the comment section, what do you think can be the addressal to this situation, be it terms of governance, be it in terms of industries, be it in terms of public. You can put it down all in the comment section. That was all from my side. Thank you so much.